Okay, and you can go ahead and get started whenever you are ready.
Okay, sounds great. Thank you. I love technology. I love that it works every time you need it to work, and then it doesn't. Good morning to everyone. My name is Mike Weston, and I'm the Executive Director of His Branches Community Health Center. We're a nonprofit medical clinic that has offices in the 19th Ward. That's just on the southwest side of the city, and one in the Beechwood neighborhood. So we have a couple of different options. I have been at His Branches for 4 years. I started in 2019. I came on in the role of what we call a center administrator. My job was to make sure that everything in our organization was run according to guidelines and regulations. And then I stepped into the role of executive director a couple years later. So I've been the executive director for 2 years. I have lived in Rochester for about 10 years. I have 3 kids and my wife, Michelle. So my kids are the ages of 9, 11, and 13. For fun, our family loves baseball and love having a chance to watch movies and hang out together. So that's just a little bit about myself. His Branches, again, we were founded in 1978. So this is our 45th anniversary. We've been in the city that long. We exist to show God's love by partnering with others to bring hope, healing, and restoration to our neighborhoods through medical care and community development. So we try to help people take their next steps, both mentally and physically, but also economically as well. On the left, you'll see the shot. This was our team when they started in 1978. It started with a team of 5 people, and currently we're up to about 30. So you can see the amount of people has increased over the 45 years, and the diversity of our staff has increased in that same amount of time. Here's a shot, picture of a couple of our locations again on Arnett Boulevard. You can see our clinic there on the left side. We have 5 exam rooms at that location, and then on the corner of Bay and Goodman, we're in this building in Beechwood. Our patients, we have about 3,500 patients that we currently serve. 75% of those live within the city of Rochester. 6 out of 10 of them are Black and African American. 1 out of 10 or 11% are Hispanic or Latino. The majority of our patients are on Medicaid or Medicare. And then 10% of our patients are non-English speakers. So we have a large percent of our population that we work with are from a number of places. One of the things that we work specifically with as it comes to community health, we believe that health begins in communities. So we have a process, and this is something that you'll see throughout healthcare. It's called the social determinants of health. And that's a fancy way to say basically the neighborhood where you're born, where you live, work, play, and or worship impacts your health, both how long you live and how well you live. And so you could probably think of that in your own life, in your own journey. If you think about your family, if you think about where you live, how long you've been educated, how much money you make, what you're able to eat, and where the house that you live in all impacts your health to a positive or negative degree. So for us, as we think about education, the sooner the sooner a child is able to read, the better they're able to comprehend, the better they're able to understand like what happens in a classroom, and the more they're likely to remain in a GED program, get a high school degree, or even eventually move on to college. And how long someone is educated actually impacts their ability to make better money in the future, afford housing that is sufficient and stable, and ultimately impacts how long they live. Another thing that goes on that is nutrition. Many of you probably live within the city of Rochester and don't have a grocery store That's within a walkable distance. You can't ride your bike there, but you probably have to get in a car or in a bus and go, 15, 20 minutes to a grocery store. So the harder food is to get, the more likely you are to eat food that's not good for us. And then the more likely that food that's not good for us is to create health problems from hypertension, where your heart is working much harder than it should, diabetes, where your body can't function out the bad system, the bad part of the food you're eating. All of that just plays back into long-term health. So we work with individuals in our city to identify barriers to health, and that's called the social determinants of health. And so something that's specific to Rochester is that minorities who live within Rochester average nearly a decade of life less than white residents living in the suburbs. So how we address nutrition, education, healthcare, and all those pieces, all that impacts how long individuals like you and like many people on my staff are able to live. And so our goal is to see a decrease in that difference between the length and quality of life that is currently experienced by those in Rochester. One author has said, your zip code matters more than your genetic code in determining the length and quality of your life. And so that's what we're trying to work against. So there's no reason that someone who lives in the 14619 zip code, which is where our main office is located, should live 10 years less than someone who lives in 14616, which is the suburbs that one of our providers currently lives in. We think everyone should have access to healthcare in a way that gives dignity to who you are as a person, to your culture, and then also to your neighborhood. And so all of you are working through this program at Oases. You all have hope. You can see that your future can be better as a result of the impact and the path that you're taking. And you're owning that, you're taking responsibility. And a group like His Branches, like, we're here to help. So what do we do at His Branches? We do primary care. So we want to keep people out of the emergency as much as possible. So we come alongside individuals. They can be as young as newborn infants can begin to receive care at His Branches. And we help you begin to take care of your body from the earliest point of life. So again, we have patients that are the age of brand new. The patient came in a couple of days ago, was 8 days old. So our youngest patient is 8 days old, and our oldest patient is 102. So if you find yourself between 8 days old and 102, you're the perfect candidate to receive care at His Branches. Not only do we do primary care, again, the primary care, you can come with us. We can get to know you, get to know and understand how your body is working and functioning, so that we can help connect you to specialists, so that if you have something wrong with your eyes, we can connect you to someone who's able to work with your eyes, an optometrist. If there's something wrong with your feet, we can get you to another organization. So we help you manage your care according to your health goals. Not only do primary care, we also do mental health counseling. So if you've experienced trauma in your life, whether that's from a place you lived before, whether that's from your family experience, whether that's from this lack of safety of where you live now, we're able to have a conversation with you in order to help set goals to help you have the determination and the grit in order to get through those experiences of life, while doing that in a way that recognizes that you have indeed been pain, and that there's emotions that you need to work through in order to end up on the other side. So primary care, mental health, we do laboratory services as well. So this is a job that our medical assistants do, which many, if you are pursuing a health education, this is a great first step for individuals to take on. So the majority of our medical assistants are those who live in and around our neighborhood. And we're regularly looking for these individuals to join our team. So once you come to His Branches, we try to take care of as much as your health needs on site as possible, so that if you have to take time away from school, if you have to take time away from your family, you have to take time away from your job, you're able to do that in one spot, instead of wasting an entire day driving around town from our office to another lab somewhere else in town. We also do support services. We have case managers on site, like Brittany, who can help you if you're looking for a job, if you're looking for housing, if you're looking for anything along those lines that would keep you from being able to access healthcare or that are impacting your health. We could help you through that process, from food, clothing to shelter. Our case managers are on site in order to walk alongside of you, including to get insurance. We can help you through anything that ultimately impacts your health. So here's just some icons of what is offered: primary care, mental health counseling. For women, we take care of women as well as do deliveries. Anyone who is pregnant, we would work with you in order to make sure that you and your child receive care. We take care of children. Case management, we do telehealth, so you can do a video call with us, and we do all vaccinations. Again, this is generally our hours that we have at our clinic. Basically 8 a.m. to about 5 p.m. most days of the week. We're on the bus line. It's bus route 17. And again, if you, for some reason, are lucky enough to live in the 19th Ward, it's a really easy walk, especially on beautiful days like today. Then on Goodman, we're currently open 2 days a week. And in each of these, we have walk-in hours. So if you currently don't have a provider, you're able to come in and become a new patient. Basically any time between 8 and 12 p.m. You can 8 a.m. and noon, you're able to come in and establish a new patient. And again, as my friend Dr. Amalora has said, health begins in communities. So what we do in the community is more than just healthcare. Just this past weekend, we had a bike clinic at our office where we gave away 20 bikes to people who are from our neighborhood. We think it's important to create trust within our community, and then we want people to begin to eat and exercise appropriately. So we try to create ways for that to happen. So we had about 30 bikes that were repaired for people who already had bikes and gave away 20. So it was really nice to be able to connect with our community in that way. In a couple weeks, we're painting our street in order to make sure that there's safer mobility for patients and our neighbors to get to and from our offices. So it'll help reduce car speed in our community. So again, we work specifically with the social determinants of health, things that impact your life and in your ability to live a longer and healthier life. And again, our goal at His Branches is to change the future of healthcare one neighbor at a time and one neighborhood at a time. I'd love to answer any questions that you'd have. Again, whether that's something about becoming a patient, about the work that we do in our office, or about the types of careers that are available as a result of being a partner with us. My friend Javier Tona also shot me a message to remember that if you are interested in healthcare at our organization, he has flyers to the teachers in English, Ukrainian, Pashto, and Dari, and also some Spanish. Ooh, great question. On translation services, we have 25% of our staff currently speak Spanish. So if you speak Spanish, we have really accessible options for you on site. For the majority of other languages at this point, we utilize a telehealth service in which we have Zoom monitors and screens in the office that interact with a translator that's live on the screen that work with our providers and our staff. So not only do they just speak languages, but they also many of the times are from specific regions that are able to come through. So even with the recent Afghanistan conflict, we have an individual who was a part and was injured in some of the conflict, and so he's been able to receive translation from someone who's from his town and not related to someone who's done injuring to them. So we try to make sure that you not only feel as safe as possible while you're in our office, but also try to make sure that anyone that we introduce you to is someone that is also safe and trusted as well. Yeah, so that's a great question. Another question that came up was someone who has health insurance. So uh, if you have health insurance through Medicaid, Medicare, we'll see you in our office. If you have health insurance through a job, what we call commercial insurance, you're welcome in our office as well. And if you don't have any insurance at all, we will continue to take care of you. So regardless of your ability to pay, we take care of individuals who come into our office. So 100% of the people who walk into our office are able to get care regardless of their insurance status or even their ability to pay. Great question. So insurance, public insurance, no insurance, we'll see anyone who wants to be a part of managing their care. Great question.
Do any other classes have questions for Mike?
Mr. Chona, am I leaving anything out? I know you have fresh eyes on this. Did we get it all? Yeah, so
Oh, I think Mr. Chona's trying to say something, but we cannot hear him.
oh.
Shoot, do you want to put it in the chat, Mr. Chona? We can read it out loud for you.
while he's talking, another question came across about dates and times we're open. We're open on Arnett Boulevard, 340 Arnett Boulevard, basically every day from 8 to 4 p.m. There's some days that we're open earlier, 7:30, and a couple days where we're open till 6 o'clock. But you can count on 8 to 4 Monday through Friday is when we're open. And then on those days, if you don't have an appointment already scheduled, you could walk in and receive care. It's kind of a first come, first serve from 8 to 11:30. We have appointments that are available. So if you have a broken arm or, if you have a drastic injury, that's something that would be taken care of at the emergency room. But if you just generally have a cold symptom or you're concerned about anything else, that would just generally be, I want to become a new patient and start to manage my care with you. You could walk in at that appointment from 8 to 11:30 a.m. And then you could even call us or see us online. So our phone number, we'll follow up. The phone numbers are on the flyers that your teachers have. So
There's another question in the chat, Mike. For those who don't have insurance, will they need to pay?
yeah, so we typically have so if you don't have insurance, we do a waive, and so your first 30 days are in a sense, we can work with you to make sure you don't have any outstanding bills, and then we can help you get insurance. And even if you don't have insurance, we would ultimately work with you to help write off those bills so that you're not risking not being able to eat or get to your job as a result of our healthcare bills. So that's how we typically handle that. As we waive the fees, we try to help you get insurance, but either way, we'll see you one way or another.
Any
Great question.
other questions before we wrap up this morning?
And there was a great question about, we currently use translation services because it's really easy to utilize telehealth, but some of the languages that we begin to see more of are Ukrainian. Individuals are coming into our office pretty regularly. So if you speak Ukrainian or are interested in potentially working with us as a translator, we could talk to you even about part-time positions that we might have available in the coming days. And the more we have individuals from different countries and different languages, we can always continue to expand both translation services as well as medical secretaries and medical staffing as careers develop. So we are always continually changing, and the more we're able to help community that is different from me, the more our staff is going to look different from me.
Oh, here's one more question. Dental services.
That's a good one. So our office does not do dental, but we have dental partners that we would be able to help you get connected with. So we certainly recognize that your teeth are an important part of healthcare. So we have contracts that we can connect people to. Oh, that's another great question. If legal immigration status or lack thereof impact service, we will see you regardless of immigration status. So if you're a human being that's participating in this call today, we'll take care of you. So that's our job is not to do anything but to make sure that you're taken care of and have the best opportunity for a long and healthy life. And we don't and just so you guys know, we don't report specifics on anyone to anybody. So if that concerns you, you can come in here and get care. We're not sending your name or information to anyone that's any kind of government agency or anything that would be a concern. So this would be a safe opportunity for you to come and receive care. So we don't report names and information to anyone, any kind of reporting agencies, nor are we required to.
Well, thank you so much, Mike, for this presentation, and thank you for joining us. Thank you to Mr. Chona, who's not here anymore, it looks like, for connecting us. If you all have any questions, you can email them to me and I can send them to Mike. Thank you all for coming and have a great rest of your day. Bye.